right, so thank you for joining us for today's edition of Healthy Bites. My name is Natalie Preston, and I direct the Office of Engagement and Constituent Relations here in the College of Public Health. And today's guest is Candace Webb, 2018 Outstanding Alumni Award winner in the College of Public Health. So I have some conversation starters, some just general questions I'm going to ask. If anyone has a question, feel free to chime in. If anyone is tuning in online, you can also type in your question, and we have someone monitoring it, and we will get to it as soon as we can. So Candace, why don't you start by telling us a little bit about yourself? Where did you grow up?
Yeah, so hello everyone, thanks for joining today. This is exciting to be back here at the USF College of Public Health. And I graduated back in 2006, believe it or not, so it's been over 10 years since I've graduated. So I'm a Tampa native. I was born at Tampa General Hospital and was raised in East Hillsborough County and went to King High School, like less than a few miles away from here. And went to the University of Florida, go Gators, for undergrad. But the Bulls are in my heart, and so USF is what launched me into my public health career, and I'm glad to be a part of the USF family. So that's my background.
And what was life like for you as a child?
Oh, I had a great childhood. I took piano lessons, dance lessons. I read a lot. I went to the library. The what was then the Tampa Bay Performing Arts Center for concerts. Now it's the Strauss Center. So do typical Tampa things. The Hillsborough River, the beaches. So it was a fun childhood here.
And what did you want to be when you grew up?
I wanted to be either a medical geneticist, because during the 90s, the Human Genome Project was always in the newspaper, so I was really interested in genetics at the time, and then either that or being a pediatrician or obstetrician. So I was always interested in health. And during high school, I actually volunteered as a candy striper, American Red Cross hospital volunteer at Tampa General Hospital. So back in the 90s, yes, I had the blue and white tunic. Yes, I had the tunic and everything. And back then they let us do a lot more, so I really got exposed to healthcare from a clinical perspective and from a hospital perspective, so I really became interested in patient care and got to see what quality healthcare did look like, so yes, got the bug early.
Would you say that was your first introduction to public health?
Yes. Well, from the clinical health perspective, but from the population and community health perspective, that really wasn't until undergraduate school. So my first semester of college, I lost my mother to complications with HIV. My very first semester I was pre-med, and that really introduced me to racial and gender-based disparities in healthcare and what happens when you don't have access to healthcare and the barriers that people face, both stigma as well as the actual structural barriers in the healthcare system. So that really kind of launched me into public health when I was in the undergrad school.
Okay. So you went there as pre-med. What did you graduate with?
Yes, I graduated with a health education degree, actually, from the University of Florida in the College of Health and Human Performance, and I minored in anthropology. So I was really interested in how culture and social influences impact health and health behavior and health-seeking behavior. So I really found a home there, and that really opened me up to what public health is. Okay. And my faculty members there actually encouraged me to apply to USF.
I was going to ask why USF got on your radar.
Yeah, so a couple of my undergrad faculty advisor connected me with some of the faculty. I always pointed out some of the faculty members at the USF College of Public Health and encouraged me to apply here because they knew they would be good mentors, and they matched my interest in women's health and adolescent health and sexual and reproductive health. So one of my UF undergrad mentors connected me with faculty members here, and so particularly Dr. Perrin and Dr. Daly. And at the time, USF College of Public Health in 2003, when I was applying to graduate school, they were the only accredited school of public health in the state of Florida at the time. And I wanted to go to a reputable school that was established, and the maternal child health program here, the faculty were established, and I wanted to train wonders to establish people.
Okay. So you arrived here in 2003?
2004. Okay. Fall 2004.
And what did Candace do as a student? What were you involved in?
Oh, gosh.
Outside the classroom?
Yeah, so I was fortunate to get a graduate research assistantship the community and family health department, and that was amazing. So I got a chance to work in the department. I kind of infiltrated and enmeshed myself and got to know the faculty and the staff on a first name basis, and they really treated me as collaborators, not just as students. So I kind of practically lived here at USF, and I enjoyed it. And I live not too far from here. I lived at Malibu Apartments, like over on 50th Street, I believe. So I walked to campus, I walked over here, so I was really fit. I was able to walk all the time, and I really liked that it was a walkable campus. And so that was really great. And so student organization-wise, I was a part of the Public Health Student Association, the Global Health Student Association, the Black Graduate and Professional Student Association on main campus. They held great events. I got to see Dr. Cornel West when he came here. That was really cool.
That was
great.
Marshall.
Yes, the old Marshall.
Have you gone to the new Marshall Center?
I haven't yet. I haven't. I've heard that it's amazing. I need to. Okay, awesome. Yeah, and it was really cool. Yeah. And then at the time, also, I was part of the founding of two organizations. One was the Student Global AIDS Campaign here on campus, and then I was part of the founding team for the International Health Service Collaborative in the first.
Really?
Yeah. So that had medical students, nursing, medical students and public health students for sure. The first group.
Wow.
We went to the Dominican Republic for our first sustainable health trip. Yes, it's really exciting.
Cool.
Yeah, and I'm still in touch with some of the founding students from that group too.
Okay.
So.
Wonderful.
Yeah.
So, what about your volunteerism or field experience? If you remember.
Yes, I do. Of course, I remember Natalie Preston because you were my field experience coordinator at the time. So a part of the MPH degree requirements, you have to, at the time, I think you still have to do it, maybe it's something else now, but at the time you had to complete a field experience and a special project. So I was fortunate, Dr. Perrin was my academic advisor in the maternal and child health concentration in the CFH department, and she was very supportive in all of my interests in trying to do a lot in my 2 years to graduate on time. So I ended up being able to do a study abroad program in South Africa just because I wanted to. And so Natalie was helpful with that, and Dr. Perrin was helpful with that, and Dr. Daly as well. And I was able to do that and enrich my experience and be able to study abroad at the University of Cape Town, at their School of Public Health and Faculty of Medicine, Family Medicine. And that was a really great experience to enhance what I was learning here at USF. And for my field experience that I actually got credit for USF for, I was able to secure an internship up in Washington, D.C., which is a foreshadowing to my life in D.C. for the past 12 years, with the Public Policy Office of the Foundation for AIDS Research. And they're one of the longtime funders to invest in innovative HIV research, both basic science as well as clinical and different types of biomedical interventions. And so I was able to finagle away into an internship there.
So share
how I did that. Okay. So I was a part of a group called Advocates for Youth. It's a national nonprofit organization based out of Washington, D.C. And they build the leadership skills of young people who are interested in being sexual and reproductive health advocates. So I applied for that, I think back in 2001, and I was still an undergraduate student at University of Florida. And they provide training on how to communicate with the media, how do you write opinion editorials on health topics, how do you participate in local decision-making bodies like the Ryan White Planning Council here in Tampa, for instance. How do you to help contribute to decision-making by local leaders, local elected officials on how they're going to prioritize health issues and where they're going to prioritize the budget, in the budget. What populations are going to be served, which organizations are going to receive the funding, how do you outline the criteria for which organizations are going to be selected to get the money, the highly coveted money to spend on HIV prevention, for instance, in the Hillsborough County area. So they taught us how to be young people and be youth leaders on these predominantly very adult decision-making bodies. So they teach us how to communicate, how to interview, what to wear, what to say, what not to say, how to prepare for it. And so they convened a lot of young people from all over the country into Washington, D.C. for what they called urban retreats. And we got to network. It was like my first time learning how to network with other young people. And they support teens and college-age students, so 16 to 24 years old. So I was an undergrad when I joined, but there were teens there too in the teen group, and they helped to get comprehensive sex education into their school districts and into their curriculum. And they also focus on building the leadership skills of young people and the adults to work with young people. How do you help young people be leaders, and how do you help incorporate them into boards, for instance, boards of nonprofit organizations, to get the youth voice into nonprofit health organizations. And so they help both the young people and adults who want to be youth, to build the leadership skills of young people in the health space. So they were really kind of like the extracurricular folks for me. Like, they kind of helped round out my substantive, like, scientific foundations from undergrad and at USF, and they kind of helped prime my advocacy skills too. So anyway, so that organization, they flew me to Los Angeles to be like a youth representative at the National Black Women and HIV Conference in 2003. And the woman that sat at my table, I was like the youngest person in the room, I didn't know anybody, but the woman that sat at the table, Judith Auerbach, she's now a professor at University of California, San Francisco, and she was then the vice president for the public policy office at the Foundation for AIDS Research in Washington, D.C., and she just reached across the table. It was just like one of those that was meant to be. She's like, here's my card. I've got 2 MPH grads in my office. One went to Tulane and the other one went somewhere else. I can't remember. And if you want to talk about an internship or anything, if you want to connect with people who already have MPH degrees, let me know. And so I was like, okay, I will. So I took her card, and I knew that she was going to be presenting at an upcoming American Public Health Association annual meeting. And I think, was it in Philadelphia maybe that year? I can't remember where it was, Philadelphia or Boston that year. And so I was very eager, and I came with my resume and tote to the conference. I stalked her at her session, and she had a long line of people ready, like, waiting for her after she had done her presentation. But I prepared. I emailed her beforehand, before I flew to the conference. I think I got a Sharp Award to go to that conference. I emailed her and was like, oh, I'd like to have a informational interview with you over brunch or coffee or something, so we can talk about a potential field experience at your office. And so she was like, absolutely. And I was like, yeah. So I already was, I went to the APHA annual meeting with a meeting already in line to line up potentially my field experience in DC. And I knew I wanted to go to DC or Atlanta. CDC, of course, Atlanta's a mecca for us public health folks, and then DC as well for national and global health work as well, and the policy space around health. So that really was it. So I went and, I saw her at the conference after her session, and we had our meeting. I gave her my resume and talked through it, and that was it. And then I just coordinated with Natalie as a field experience coordinator, did the paperwork, and filled out the forms. She became a practicum preceptor, to get on record with USF, because they hadn't had any students yet go there. So kind of, pave the way for that. So people should take advantage of it if it's, if you want to do that. I can connect you with them. And that field experience, I also had an opportunity to do qualitative research with about 20 different domestic and global HIV leaders, women and HIV leaders, and made that my special project. So I worked with Dr. Perrin as my academic advisor to create a special research project where I could do research to help provide data and information for the actual organization, something that would be beneficial to them. And so I got to network with a lot of people, and in the process of interviewing people, they were kind of inadvertently interviewing me in a way, and I was able to I got 2 job offers from interviewing them as a part of my special project. And one, I could have gone to be a policy associate with AIDS Alliance for Children, Youth, and Families, or to be a program associate. And because one was, I interviewed the director of programs, and I interviewed the policy director, and they both offered me, job opportunities. So I had a choice of two, and that was fantastic. So that was summer of 2006, and I had not finished my special project, so I didn't graduate actually until December 2006. But I got the job offer at the end of my summer field experience. So then I told Dr. Perrin and Dr. Daly and everyone, I'm like, I got a job, I'm moving to DC. In like a matter of 2 weeks, I moved from DC from August to September, and I was there. And I was able to finish my coursework, and I flew back to do my concentration exams, and then walk in December. But I was able to, and my job was great. They let me work 4 days a week, and then my 5th day was really finishing up my special project on that Friday. And that, they knew there was an end date to that, so they weren't, but I was still getting paid. They wanted me. Yes, that's what happened.
I know that was an amazing networking story that she has. That's why I asked her to share kind of the backstory of how she was able to secure her.
I was not shy.
And the lesson to be learned is to always be ready and aware of opportunities.
And I created cards, like Vistaprint cards. I created my cards and put my special interests on the back, and use that at APHA, the conferences and anywhere I was going to help market myself to people.
So I know you said your mom's death motivated you to enter the field of public health.
Mm-hmm.
So when you came here, what did you want to do, and how does that line up with what you're doing now?
So it's
you were MCH, is that
maternal child health. Yes, I was maternal child health, and it's funny. In one of my maternal child health core concentration classes, Dr. Bryant, she's retired now, but she was the social and behavioral sciences core instructor at the time, and was a great instructor. And she, I believe, guest lectured in one of my MCH classes, and they were going around the room and saying what kinds of career opportunities there were. And I remember clearly, she pointed at me and was like, "Hey, I can see you as a product officer in the federal government for, the Health Resources and Services Administration." This is back in 2004, 5. And I ended up becoming that. And I was just like, oh my gosh, it just meant the world to me that she thought that I could accomplish something like that, mm-hmm. and to be able to strive for something like that. So I still remember that to this day. And so my journey has been varied. And I knew I wanted to work when I was at USF. I knew I wanted to work at the nexus of research, advocacy, and research and advocacy, really, because I knew that my training as a youth leader was founded in activism, like HIV activism and youth activism, and but I wanted to professionalize that and be credible and have data and evidence to back it up, which is why getting the MPH degree was important, because I wanted to know the epidemiology. I wanted to know how to evaluate quality studies and be able to create and craft arguments to policymakers, to people who control the money, to be able to have sound arguments. And so that's really what I wanted to do with my degree. And so, but I knew I wanted to, and I had thought about doing my doctorate degree right after the MPH program, because that also gives you the credibility. And I still aspire to acquire a doctorate degree to amplify my my analytical skills even that much more, and to refine them. But I knew I wanted to also have and apply all the theory and knowledge that I had acquired. I wanted to actually go out and use it, and do public health work, do governmental public health work, and be an advocate. And because all the faculty here that I really valued during my program, they all had experience outside of academia, and that enriched why I love them in the classroom. Like Dr. Daly, she ran a women's health clinic, and Dr. Perrin was a nurse for many years, and worked with adolescent, young, pregnant women. So they actually had actual experience, and that's what I liked about them as teachers. And so I'm like, if I want to be a professor one day, I want to be able to have that kind of practical experience and bring that into the classroom. And then also to have an informed, approach and grounding when I do my doctoral program, so I can have real life context to bring into that experience. That's kind of what I wanted to do with when I was here.
Okay, and your actual career path since leaving here?
Yeah, so it's been windy. It's been very windy, but it's all made sense in hindsight, of course. Like when you're doing it, it doesn't make sense. Well, it does make sense, but you can see the thread and how one thing builds upon another when you look back on it. So I've been able to work so I have eclectic public health interests. One day I could be like really anti-tobacco. I want to be a anti-tobacco activist, and the other day I want to, make sure that biomedical HIV preventions are getting to the right people in the right place at the right time. And so I have varied interests. And so fortunately, Washington, D.C. has been a hotbed of great public health, work experiences domestically, globally. And so I worked in the nonprofit national advocacy space for nonprofit HIV and women's health organizations. And I've worked, actually I did a stint with the military health system, doing research on mental health stigma and HIV stigma in military populations, the U.S. military population, the Belize Defense Forces, and then I've worked, fortunately, with different federal Department of Health and Human Services agencies as a contractor. So with SAMHSA, Substance Abuse and Mental Health Services Administration, I was a CDC, Division of Adolescent and School Health Cooperative Agreement recipient, the organizations I worked for, and then I worked on site at the National Institute of Health at the National Institute on Drug Abuse in their Public Health Division of Epidemiology, Services and Prevention Research, and that led me to becoming a federal employee, and I joined the Health Resources and Services Administration and worked in the HIV/AIDS Bureau and the National YY HIV program, which is the largest domestic federal program to care for people living with HIV in the United States. And so I worked with them for about 5 years. I was a project officer, like Dr. Bryant, foreshadowed me to become one day. And then I was a supervisory public health analyst. I was a branch chief for a team of 6 project officers in the division that I had entered in. And so recently I'm wanting to hone my policy skill set and add to my toolbox. I'm someone that likes to add to my toolbox over the years. So I seek out opportunities where I can build on my skill set, and I see where there are deficiencies and where I can be a better advocate. And so I'm learning that public health financing is critical. Medicaid, the Children's Health Insurance Program, Medicare, and the Affordable Care Act, the private health insurance system, they're so impactful on access to care issues and the criteria and the expectations, the standards that we set for managed care organizations and their role in addressing social determinants of health and health disparities. So knowing how that system operates is really important for me, and I'm currently working at the Georgetown University Health Policy Institute in their Center for Children and Families. So still working on priority populations that matter to me, women, children, youth, and families, but I'm able to do a deeper dive into the healthcare financing space and seeing how that intersects with the public health system and where they do and don't communicate, and where there are, just completely different languages, and sometimes public health people don't understand the healthcare financing world, and healthcare financing people don't understand the public health side. And so I really I'm a systems thinker, and I like to bridge, and so this is my opportunity to help bridge the healthcare financing space and the public health space. So I'm getting paid to learn is how I feel. I'm bringing the public health knowledge to my current job, and I'm able to learn in the process from some amazing scholars that I get to work with at Georgetown.
So how did the College of Public Health prepare you for all the different roles that you've had thus far? And what do you wish you had explored while you were here as a student that maybe would have better prepared you for one or all of the different?
Yeah, good questions. Let's see. So USF, because of the way the MPH program is built, you get exposed to all the core, areas of public health. So biostatistics, epidemiology, health policy and management, environmental and occupational health, and the social and behavioral sciences as they apply to public health. And a lot of the work, as you guys know probably, is group-based, and a lot of interprofessional teamwork. So that helped prepare me for the real world of work, because they're always working in teams. People that have different ways of writing, different timelines, and the way they approach getting deadlines met. And you have to be able to learn to work with people that you might not get along with well, but you still you're held accountable for getting work done. So I think USF helped ground me in my scientific literacy, knowing how to evaluate quality research and how to use research to inform program development and policy, formation, and in an applied way and rooted in social justice and vulnerable populations, priority populations. So that's how USF prepared me. And then in terms of what I wish I had known when I was a student at USF, probably I would have done more study abroad, because I like travel. And then as a student, you have a lot more flexibility because you don't have
and more funding
support. Yes.
That would be a do-over.
Yes. Yeah. I would study abroad more, and I did study abroad, but I would have done it even more if I could have, or done international trips or even domestic trips to different parts of the U.S. And so that I probably would have gotten experience on the U.S. Capitol, like the Hill experience, more political exposure, and how elected officials, and maybe shadowing and working as an intern with the Senior Advisor for Health and Human Services and the Health Beat, like the folks that are in charge of that particular elected official's health portfolio, because they're the ones that really do a lot of the writing of the legislation, and they're the ones that consult or don't consult experts. They're the ones that form what becomes our programs, because laws inform the appropriations, and laws and appropriations, and that's the money, and then the actual substance of the work, and those then are enacted, and they're implemented by the administrative, the executive agencies, and those are the programs that we as public health professionals work in. So if you go to the beginning and create a just and appropriate law, and you write a good law, you get better programs and services at the end of the line. So probably getting more Hill experience and political exposure earlier on. So I think focus on those for now.
So if you could write your own ticket, what would be your dream job?
Oh gosh, I wrote out so many of my dream jobs. If I have to work, yes. So with that said, I would be a professional intern because I have so many interests, and I'd love to be able to just go to different organizations. Seriously.
10 plus years out, you still have all these interests that you want to explore.
Yes. I'd probably want to be able to put on my philanthropist hat and work for a philanthropy organization. That's actually a job I would like. I haven't done this yet. I do want to do this, to work for like a Bill and Melinda Gates Foundation or a Robert Wood Johnson Foundation and be a project officer there, because they have sometimes more unrestricted. In the federal government, you've got more restrictions because it's tied to laws and regulations and policy. When you're working for, someone like a philanthropist, you have sometimes way more flexibility. And so I really would love to work in philanthropy and be able to have kind of unrestricted use and be really innovative and pilot new initiatives. And so that's actually my next dream job. There we go. Anyone out there listening? In a foundation.
But realistically, not that that can't happen, where do you see yourself maybe going next?
So what I'm currently working on now is establishing a public health consultancy and coaching business for myself. So I've been doing a lot of coaching over. So I've been doing. I really enjoy mentoring and leadership development. And so one of the other things actually for current students is seek out mentors everywhere, all the time around you, and then also be a mentor. You can always be a mentor to somebody else too, coming up behind you with your interests. So that's another thing that I've been fortunate to have a lot of mentors, and I constantly acquire new ones. If I see someone who's inspirational, I seek them out as a mentor, and I've been grateful to have really great mentors.
So for people who haven't done that or may not be comfortable, how do you go about doing that? I mean, you just out front say, hey, I'm looking for a mentor. Where would you be?
LinkedIn is really great. Okay. I use LinkedIn a lot. People reach out to me through LinkedIn, and I've reached out to people because it's kind of a conversation starter because you have all your interests already written, and you can refer them to that. You can have a simple line in the email you send to them, and then or the message you send to them. So it's kind of like it's a easier way to help facilitate for people who are shyer or who might not be interested in cold calls or cold emails. It's warmer in my experience, and if you have common connections or if you have common groups in line, that can help break the ice. So that's something that has helped me actually be able to broker new connections. And then people have reached out to me. I've done a lot of career talks, many informational interviews for people trying to get into DC, into the DC public health scene. And if I don't have the information, or if I'm not an expert on something, I might have a contact in my network, so I connect them to that person. But so it's been a real big help for me on the networking and the mentoring, identifying mentors side.
So for students here or online who may want to follow your career path, either your line of work or end up in DC, what tips do you have for them?
Yeah, so, well, you guys...
Or entering federal service.
Yes. So, let's see, reaching out to people who are already doing things that look like something you're interested in. I think reaching out to them, using any connections you have, or LinkedIn, or just, marketing yourself and what you have to offer, and just be genuine, be yourself. People tend to respond well if you're genuine and you demonstrate passion for whatever you're passionate about. That goes a long way. So I think also just staying true to what brought you to public health, and that's important, because because it's not going to always be glamorous. You're going to have a lot of work that you don't like to do, but but it's important to make time for self-care and to stay charged and recharge yourself into what drives you and what keeps you in public health. I've had to make decisions that were hard because I needed to have a self-care reboot moment, and people are going to look at you weird, but it helps me stay recharged and strategize on what I want to do and what's going to keep me utilizing my talent the best way and keep me in the field, because this is my, I love this field. It's my passion. And so also networking in your own way, going to networking events or conferences and volunteering. I'm looking into doing more board service now, to serve as because we have expertise as public health folks that we can bring to the table to nonprofit organizations to help with writing grants for the organization, or developing programming, doing fundraising, helping with advocacy, with the whole range of work that boards and nonprofits do, for instance. And also different levels of government, local government, state government, federal government. There are always councils and committees, and they're always looking for volunteers. So I think identifying those areas that you're passionate about and finding ways to do pro bono volunteer work to get your name out there, to get the actual practical experience and to network, that's really helpful. I think I've learned that from other people, and I've done some of that myself.
Okay. So I'm going to pause. Have we had any questions to come in online? Okay. For those here in the audience, do you have any questions or comments for Candace?
Like, what would be like a normal day like at your job, like up in like DC? Because that's something like I'm kind of interested in. Okay. So like going to work, like what would your normal day be like? Yeah,
so where I currently work now, I work in in the district at Georgetown University in their Health Policy Institute, and that's actually in their public policy school, the McCourt School of Public Policy, and I'm in a center within that school, the Center for Children and Families. So the work I currently do is funded by the Packard Foundation out of California, and they have a whole children's health portfolio of work, and they fund about 18 different states around the country, different child and family health advocacy organizations who are staffed by advocates, public health advocates, and children's health advocates. And I work to support the technical assistance we provide them to help make sure kids in their state get access to health coverage, whether that's through the Affordable Care Act, Medicaid, or the Children's Health Insurance Program. And then we also help support them with their communications work, their policy strategies, how they're going to move the needle on whether it's children's mental health issues, school-based health care, addressing oral health disparities among young people, tackling racial disparities, and trying to influence their state, their state officials, the governor and the state health department agency staff, or Department of Education, whoever it might be, to help them advance the policies within their state. We also, because of the current climate, there's been a lot of attacks on bread and butter safety net programs, whether it's Medicaid, the Children's Health Insurance Program, bread and butter supports for low-income children. So we've helped to organize the advocates across the country to protect health care coverage for children. And so we try to get common messaging, and we provide the policy, the facts, to help show the economic, the long-term economic and health and education benefits of investing in children's health early on. And that's through, when children have health coverage and when their parents have health coverage, they tend to stay in school better, longer, they graduate from high school, they tend to be employed more, they become taxpayers. So we provide the evidence, the policy facts. And a lot of that is economic research, like health economic research, and public health studies, and education studies. Multidisciplinary. So we tap into the range of research on what policies are effective, and we help arm the state advocates with that information. So my work is really helping to keep all these advocates nationally informed with what's happening in DC on the Hill, at Centers for Medicare and Medicaid Services, what new regulations have come out, and how that impacts them. So I work with some amazingly smart people who I'm learning from all the time, and I'm kind of a relationship manager, and I anchor this 18-state network and make sure everyone's kept in the loop, and facilitate the technical assistance we provide them. So every day is different. That's basically, but that's what the nature of the work that I do. And so a lot of it is external facing, and a lot of relationships and policy communication, and so yeah.
I have a question. Yes. So you mentioned that you're always adding to your toolbox, and you specifically focus on the areas that you might not have had enough experience in or not efficient experience. How do you identify those areas? How do you say, I want to learn more about that topic?
So when I'm in meetings at work, for instance, there are always smarter people around me in a certain area, and so I've become a student of leadership. Because I participated in a leadership development program when I was at HRSA, and that taught me how to take an inventory of my skills and my personal interests, and kind of to help have check-in points for myself that I assigned to myself every 6 months, to check in with where am I going, am I on track with where I think I want to go. And I'm pretty intentional about this. It's not like, oh, I want to do this, It's really, I have mentors, I have check-ins. They help keep me honest about what I say I'm going to do, and I map out where my strengths are and kind of what kind of things do I want to accomplish. And if there are certain areas of knowledge that I need to gain to be able to accomplish a goal, that becomes evident that I need to be able to, whether it's taking a class, or there's a lot of free classes online too. Right. It might be like a courseware class, or whatever, or it could be as much as going to do an institute somewhere, and so, or having conversations with someone, and having kind of intentional skill building or learning opportunities. But I look at it from what do I want to accomplish? What kind of work do I want to be doing? And what do I need to be able, what kind of skills and knowledge do I need to have to be able to be a part of the conversation, to be invited to the table, to be able to contribute?
And if you don't know, I would assume you could just go out and look at different job opportunities,
yes.
job titles, and see what the qualifications are, and whatever you're missing, then that can be a starting point for things that you need
Absolutely.
to add to your toolbox so you can be more competitive.
Okay.
I have a question.
Yeah.
So a minute ago you mentioned that you were given a lot of qualitative research from different organizations, and so you kind of looked at it to analyze it and create actionable steps for them. So I also deal with a lot of qualitative data, so I wondered, how do you approach analyzing it? Do you create a system for it, like based on trends? Because that's something we've kind of looked into. So I just wanted to hear your thoughts on that.
So for my special project, when I was at in the program at COPH, I did the Interdisciplinary Women's Health Graduate Certificate, and a part of that was I was required to take a feminist research methods class on main campus in the Women's Studies Department. Probably one of the hardest classes I took because it was philosophical based, and it was really around critical thinking, and it was really challenging. So it really taught me about qualitative research, because there's a lot of qualitative research in that space. And so I learned about, so I ended up using constant comparative method, and I used NVivo, the qualitative data management software, and then they signed me up for a class up there to take it, so I can, organize the responses I got from the interviewees by themes, and then that helped me create subcategories, which then led to a smaller bucket of recommendations. So sometimes you have to just learn by doing it, and so I had the qualitative research methods book in hand, and then it was an opportunity to actually, in a safe space, apply it. And so now in in professional work, my professional life, postgraduate school, I have that as tools. And there's other software, there's a lot more that's out there now that you could use to organize your qualitative data. But you can use video, you can tag, when you do actual video interviews in Vivo. So that's the one that I prefer. But recently I did a set of interviews with about the 18 states that I work with, and it was lighter, but having the foundation on how to actually approach it systematically, it was really helpful, so I could make sense of the data. And you have to really be disciplined and want to provide quality outcomes and have a method to your madness, even when other people might not have qualitative experience around you on doing qualitative research. Sometimes you're the person that comes into the organization with that. So, and then you're constantly reading how people do it and learning how there's different blogs and different forums and there's LinkedIn groups just on qualitative research in the health field. So you can contact people to help, for help on what they've done. Some people who they focus, that's their entire consultancy life, is helping people do qualitative health research. So they know things that I wouldn't even know to ask. So just reaching out to them.
Yeah, because there's no quick fix when it comes to the spoken word. There's no yes, that all means this.
Yes, yes.
Thank you.
No problem.
Being a woman who wears so many hats and I guess went through so much and you have such a lot of experience, how did you maintain your mental wellness? Because that's really important, especially if you're in the medical field or pharmacy or anything like that, or public health. How did you maintain that over the years?
Yeah, so thanks for asking that. So self-care is huge in the health professions, and then particularly in public health, because we're usually passionate and very driven people for our causes. And so for me, everyone finds their different outlet. I love salsa dancing, so I love to walk. I go to the museums a lot in DC. I have all the Smithsonian museums at my disposal, which is wonderful. And I can just walk forever, walk along the tidal basin. I also have a strong spiritual life that I've been honing over the years, so I'm really into devotionals, and I have my moments in my office several times throughout the day to get me through. I pull it out and I read affirmations, I read things that help ground me, and then I have sister networks of people who I touch base with, people in the field that I can vent to, and that really helps to have outlet. I have a GroupMe thread with some people. We just process what we're going through. So I think having whatever works for you, but those are some of the things that work for me.
I would imagine you probably already have some of those things in place now, just in your student life, so keep them in place. So I have a question. What, as a college, could we do better to prepare the next generation of public health students, public health professionals?
Yeah, I think continue to do what you're doing, or what you did for me then. I think you guys are still doing it. I think one of the great things that the faculty do are reach out and reach back to alumni. Dr. Perrin and Dr. Daly, I've gotten current students over the past, since I relocated to DC in 2006, I've gotten emails, messages from Natalie and Dr. Perrin and Dr. Daly asking me to connect with some of the current students here at USF. So I think our alumni network is amazing. And there are a lot of USF College of Public Health graduates in the DC area doing amazing things. So I think keeping the current student alumni network strong and helping to bring the undergrad students, the grad students into the alumni network and keeping that relationship strong is really vital and important to help just to help keep the family strong, the USF College of Public Health family strong. And I think continuing to keep group-based work and interprofessional team work a part of the curriculum is really important, because that's really the real life public health professional life. So that plus I think focusing on leadership skills in public health professionals and advocacy skills, that's really important. And understanding the connections between laws, regulations, and public health services, like that continuum of in the different branches of government, but all the different players and sectors that work together, just like the cross-sector approaches to health, and knowing that public health is a part of a world, a system of health and healthcare, but there are other players in the system, and making sure that students and alumni are aware of that and can tap into that, because I think that'll just only enhance our ability to work in the world of promoting health.
Okay, good. And do you have any other advice, suggestions for students?
Yeah, just enjoy it. Enjoy being a student. Enjoy being a student. I love being a student, and I love being a student at USF College of Public Health. They're very supportive. All the award opportunities that you can get, do it. If you can do dual degrees. I wish I had done the NPH MSW dual degree, actually. I think sometimes having a clinical degree can help sometimes give you different perspectives of the public health system. And I would have done that if I had gone back, actually. I was just like, I just want to get through this program. Those NPH MSW students were working really hard. yes, I'm like, they're working really hard. I'm like, I'm just going to stick with this. But in hindsight, I'm like, I wish I had pushed myself a little harder to do both and just focus. I respected the NPH MSW students a lot when I was in school alongside them. But yeah, just get practical experience, with the AHEC, with health departments here, travel abroad, with PAHO, WHO. The USF faculty have tons of great connections through their own professional networks, so use them. Don't be shy. Ask them for introductions, and utilize the alumni network and partner with the faculty, and just really enjoy yourself. And yeah.
Well, I see you brought some literature with
I did,
you.
yes. Yeah, so at my current job, Georgetown Health Policy Institute, we have a blog, the Say Ah blog for kids, Say Ah, pediatricians. It's a children's health policy blog, and on the back it says Medicaid helps children grow up to reach their full potential, and children enrolled in Medicaid miss fewer school days due to illness or injury, do better in school, are more likely to graduate high school and attend college, grow up to be healthier as adults, earn higher wages, and pay more in taxes. So helps people understand the value of Medicaid. And I have my business cards for folks too. So yeah.
Well, thank you. Are there any more questions, comments? All right. Well, that concludes today's Healthy Bites. Thank you so much, Candace, for joining us. Thank you, those of you who took the time to come over, and those who may be tuning in online.